health might be affecting your overall well-being. In this video, I will discuss how low sensation at the penis or vagina is connected to pelvic floor dysfunction. Do tight hips impact pelvic floor health? What are the best hip mobility exercises for men? And finally, what pelvic floor exercises are essential for men's health? So let's begin. How low sensation at the penis or vagina is connected to pelvic floor dysfunction? Typically, the sensation to the penis or vagina is from the sensory input of a nerve called pudendal nerve. But not every pudendal nerve irritation is pudendal neuralgia, and it doesn't have to be as bad as what you may think. It can get there with wasting time, not treating it correctly, but not from when it first starts. You can have side effects to medication, multiple sclerosis, trauma, or things like that, causing the abnormal sensation at these areas too. But we're not talking about that. Pudendal nerve comes from the lower part of your trunk where the sacrum is. It goes through rather tortuous path through small spaces and through muscles to get to the vagina, penis, or perineum, and rectum. Perineum is that space between the anus and the front. So with the low sensation at the penis or vagina, we know somewhere from one end to the other end, there is a mechanical compression of this nerve. That means the pelvis is not stabilized and balanced, causing tension inside the pelvis, which is pelvic floor dysfunction. So let's explore more by answering questions. Can tight hips impact pelvic floor health? And the answer is a big yes. Tight hips means the machinery that gets us from point A to B is compromised and our mechanics of movement is altered. This means the pelvis is no longer functional in performance, and that means the muscles inside the pelvis have to modify themselves to fit basically the new scenario. That's what pelvic floor dysfunction and our pelvic health gets compromised. This is what happens. So what are the best hip mobility exercises for men? I'll give you 3 samples of basic, intermediate, and advanced hip exercises. And the common theme here is that the rest of the body has to support itself so the hips don't have to modify their performance to make up for a lack somewhere else. So let's do the seated, supported, internal and external hip rotation. This is the basic one. So you're gonna sit, support yourself, not slouch, not dip in. You're pushing on your hands, getting yourself nice and upright. Spread your feet wider than your pelvis. And then you are going to internally rotate. Bring the one back and do the other side. And bring it back. This is just basic. The intermediate one is the one that I call, it's called runner's pose. So you start from all 4 and then you bring one leg forward like so, and you keep your spine as neutral as you can, breathing biologically, and then you're gonna go back and forth. It's the foot and the leg that pushes you back. It's not your body taking you back. It's the legs that are doing this movement. The goal here is to make sure that our pelvis is more neutral. The last one is more of an advanced move where you sit like so, almost like 90-90, and the goal here is to keep your spine nice and neutral. I'm gonna show you the side view, and we want to get up and slowly bring ourselves down. We don't want to be leaning forward to get ourselves up. We want to use our trunk is stabilizing itself while the butt and the legs are getting us up and bringing us down. Remember, in all of these exercises, the trunk is supporting itself in the move with biological breathing intact. When functional mobility is not there, dysfunctional movements begin, and instabilities at the other end. So let's go to the last question. Why pelvic floor exercises are essential for men's health? I explained this earlier in the video. Pelvis is the foundation to the structures above. It holds important organs inside of it, and it provides a strong base for what's above. Without the trunk, we are dead. And without our upper and lower extremities, we're simply disabled. Stability of the pelvis is crucial to our existence. The whole body is created so perfectly to allow us to live a long life. When it comes to joint stability and pelvic floor dysfunction is lack of stability in the pelvis, we need to understand the principles of movement. Just like we understand the principles of driving, we need to know what wrong looks like so we catch ourselves before committing the crime, and then know what to do to replace it with. What to replace it with. That means we need to breathe biologically, like babies breathe to relax, and then strengthen the muscles inside the pelvis, which then allows that rhythmic oscillation of the internal organs to take place, so our internal organs inside the pelvis have a better chance of working better. We normally tend to complicate the solutions to our complex problems and not believe the answer if it is simple. And that's not always the case. If you need help understanding what your dysfunctional patterns look like, how to recognize them on your own, and learn what to replace them with, if you need help with the process, contact me. Let's see what's going on. Until next time, take care.